So vitamin K2 was essentially discovered by the famous dentist, Weston A. Price, back in the 20s. He didn't recognize it as K2 because it hadn't been, in inverted commas, discovered yet. But he realized that a mixture of cod liver oil and butter oil from cows that were eating the fresh growing grass in April, May, June were protecting people's teeth. And he found that the primitive societies that he went around the world discovering all had perfect teeth, despite, in general, they never brushed their teeth, they didn't use toothpaste. He never saw a cavity. But the moment that the native people started eating the Western diet, within a few years, cavities were appearing. Now, in 1997, they discovered that what Weston Price had realized in the 20s and 30s was actually primarily because the foods that were being eaten were full of vitamin K2. So vitamin K2 has been studied to a huge degree over the years. It's been found not only to make sure you have good, healthy teeth, but healthy bones as well. It works together with vitamin D and along with magnesium to put the calcium where it should be in the bones. You don't need to supplement with calcium, but if you supplement with K2, magnesium, vitamin D, then the body will put the calcium where it should be in the bones and the teeth, not in the arteries or the pineal gland, for instance. So I'd like to mention some of the studies that have been done over the last few years about vitamin K2. Turns out that the risk reduction for people who are taking the correct level of vitamin K2, 20%, 26% lower all-cause mortality, 63% less risk of advanced prostate cancer, 28% less general cancer death, 20% less coronary artery calcification, 9% less coronary heart disease, 7% less for type 2 diabetes. So if this was a drug, it would be headline news all over the place, but it's not a drug, so people are pretty much unaware of it. So what other benefits can you get from vitamin K2? Well, atherosclerosis, it will be probably one of the answers to that. Osteoporosis, we've mentioned. One needs to be careful if you're using vitamin K2 if you're on blood thinners, because if you look at the instructions or the warnings on doctors' blood thinners, it will tell you exactly the foods that you shouldn't eat, and it also warns you not to take K2, because K2 can do the job that Coumadin or the other blood thinners do. So you could over-thin your blood if you're taking blood thinners. And the incredible thing is, the doctors tell you on the warning label exactly what to do to avoid going on blood thinners. You drink more water and you eat the very foods they recommend you not to eat.